Welcome. Thank you so much for joining us. My name is Alison Marcella. My pronouns are she and her, and I'm responsible for operations at the Canadian Observatory on Homelessness. And I have the big pleasure of moderating a panel full of my colleagues. Not just my colleague, my boss right here, Dr. Stephen Gaetz. He's the president and CEO of the COH. He's also many other things, but his bio is too long. And it's in the app. If you'd like to read it, please go ahead and do that. Next to him is Dr. Ahmad Bonakdar. He is a researcher at the COH as well. And Dr. Jackie Sohn, also a researcher at the COH. So we're going to, they're all going to have 20 minutes. Steve's probably going to take longer. But I'm going to throw Skittles at him when he exceeds the 20 minutes. So you can all enjoy watching that when it happens, because it will happen. And then Jackie will follow, Ahmed will finish, and then hopefully we'll have about 20 minutes at the end for Q&A. Before we begin, you're going to get to enjoy me with glasses. Perimenopause has not been kind to me. It's impacted my vision. So I'm going to do the land acknowledgement. We'd like to begin by acknowledging that the 2025 National Conference on Ending Homelessness is taking place on unceded Indigenous lands. The Ghanaian Gihaga Nation is recognized as the custodians of the lands and waters on which we gathered today. Jojage is historically known as a gathering place for many First Nations. Today, it's home to a diverse population of Indigenous and other peoples. We respect the continued connections with the past, present, and future in our ongoing relationships with Indigenous and other peoples from coast to coast to coast. Over to you.
Great.
Your time starts now.
Okay, I have to get my phaser. So thank you and welcome everyone. Those of you having an anniversary, congratulations. So.
10 years. We met 10 years. We met at the conference 10 years ago here in Montreal.
Are you using my minutes?
Yes, I'll start over. You get
Okay.
to start.
Okay, let's go. So we're going to talk about taking innovation to scale. It's an issue that grows more and more important to me because in doing the work on prevention, we're learning so much. The knowledge base has increased dramatically. Now we need to get these great interventions in every community. How do we do that? And what are the barriers? So what are the challenges? Oh, got to get this. Okay. So this is a definition of what I mean by taking innovation to scale. It can take a long time. Look at this article here, one of the best academic article titles of all time. The answer is 17 years. What is the question? Understanding time lags in translational research. And so they're looking at health research. And what they found is that after you've developed something new and there's an evidence base for it, it takes on average 17 years before it's broadly used, right? And I'm thinking 17 years. So in 17 years, I'm going to be 50. I can't wait that long. So, so anyway, we're at a conference in Dublin a couple years ago, and Dennis Culhane, who many of you will know is the leading researcher on homelessness on the planet, probably. Anyway, he was talking about this, and he said, the problem isn't that we can't come up with good ideas. The problem is we're really lousy at taking innovation to scale in the world of homelessness. Many of the things we do are not that different than what we were doing when modern mass homelessness arrived in the 1990s. So that's the challenge. What are the barriers to taking innovation to scale? What are the enablers? And so we're going to use a look at key ingredients for taking innovation to scale, using a couple of case study examples. So one is on the evolution of Housing First in Canada, and the other is what we're learning about Housing First for youth. So Housing First is one of the few interventions for which we can claim it is in fact the best practice, because the weight of evidence for its effectiveness is huge. So the Government of Canada, under the Conservatives, made the decision based on the research of At Home Chez Soi that they wanted communities to use their federal dollars for Housing First. And so it was a government priority, and they demanded that you take your federal, now what we call Reaching Home money, and 70% has to go towards Housing First. So that's important. Government of Canada, or governments in Canada often aren't very strategic, particularly provinces and territories. But the federal government often leaps in, and so that's what they did with Housing First. So in 2013, Government of Canada renewed the homelessness partnering strategy for 5 more years, prioritized Housing First, and that was key, right? Like having government support for doing something new. Housing First for Youth, Government of Canada has made strides in its interest in and support for addressing youth homelessness and prevention. However, neither the Government of Canada nor any provinces or territories prioritizes youth homelessness to this day, nor have they implemented a focused youth homelessness prevention strategy. No order of government has a dedicated funding stream to support the implementation of Housing First for Youth. So it's not the same as what happened with Housing First. The second enabler here is the importance of a strong evidence base. I just mentioned At Home Chez Soi, and the research that came out of that is amazing and was a key reason. Think about this. If you recall the Harper government, they hated research. They were like destroying environmental research and that kind of thing. And then they made a policy decision to go down this road in homelessness based on research. So it's an important thing that, always be careful what you imagine a government is willing or not willing to do. So the evidence is overwhelming. I'm not going to go through that because otherwise I'll get in trouble with the timekeeper here. So we know there's evidence for Housing First, but now we have evidence for Housing First for Youth. And it's quite compelling. It works. Yay. Because here's the thing, when you do outcomes research on something that you think is a good thing, the research can show that actually, you know what, it's not really that good. It's not as good as you thought, but we're getting good results for Housing First for Youth, and more on that later. The third thing we have to think about is providing the right incentives, which include funding. That's probably the key incentive, but also having access to good training and support to implement things. So the Government of Canada, when they, under Harper, when they got directive and said, we want you to spend your money on Housing First, they didn't add any new money. In fact, they cut funding at the same time. So they're expected communities then to have a go at it and come up with the money and stop spending money on other things, right? So, so one of the consequences of that, by the way, is a lot of youth programs were cut. Those of you who worked in the youth homelessness sector back then will recall that. Youth not always being a priority. So a key challenge in that kind of context is there's an opportunity cost. You're forcing organizations and communities to stop doing one thing over here because they're required to spend it over here. So sector engagement and buy-in is important. You can't just do this from the top down. You have to bring people along. And so that can be a challenge because not every community, not every organization is in the space of social innovation. What's the time now?
You're good.
All right, good. That means I'll sing a song. No, I would never do that. Okay, so this is kind of an impression of how to think about being in the zone of innovation. There's probably like 15% of organizations are in that space, and you can probably, if you think about where you are from, identify some organizations that would be particularly active and innovative. There's some more, maybe 20% more who, given the right circumstances could move into that innovation space. And then there's a lot who are not interested in innovation, right? And would prefer to just keep doing what they're doing, and for good reasons. You know, people are proud of what they do. So the challenge with this kind of thing is we have to be careful of top-down approaches. You have to get people excited about something. You have to get them to want to change what they're doing. And that can take time, right? Because that's relational work that is really important. And one of the challenges then is, I'll discuss that one later. So for Housing First for Youth, we know from our efforts in Europe, the US and Canada, that resistance is a huge roadblock. And this can be true of Housing First for Youth. We found some communities are hesitant to embrace Housing First for Youth, seeing it as too radical, and their resistance makes it hard to bring it into the mainstream. So people, that's a quote from Heidi Walter, by the way, who isn't in the room. So anyway, engaging with community planning is important. So supporting community entities to think differently. You need to, for Housing First for Youth, you need the community entities to care for youth homelessness as an issue. But supporting the planning is key. And lesson learned, one of the things we learned is from Europe, where there are more examples of Housing First for Youth than there are in Canada, even though we developed the model here. And what they do are these study sessions, week-long residential study sessions, where you bring together a bunch of people from different countries, you know, up to 20 different countries in Europe. I wouldn't do that here. Be hard to pick countries. But anyway, so they went in to the study session and learned a deep dive on Housing First for Youth. And that became a super spreader event. So, you know, people from the Netherlands were at the session, and they now have like 8 Housing First programs in their country. And this happened in Ireland and Scotland and that. So there are strategies you can use like that. That's what I'd love to do here in Canada. So stay tuned. That's going to come here someday, right? Just have to shake down the money. So having a strong brand is important, and well, that's great. Okay. Is important. And so Housing First is the brand, right? Like people use it, say it. But having a brand means that people need to understand it. You know, and here's a great quote where someone was talking about how Sam Simbaris was able to package what were kind of established practices in mental health and put them together with a housing and call it Housing First. And that was a game changer. You know, that work was going on in the late 1990s. And Housing First for Youth, we are very aware that it needed to be a brand on its own to differentiate it from the Pathways model. Not because we dislike that model, but that this one's developed based on the needs of adolescents and young adults. The clarity of the definitions and the design of the program model is really key, because when the Government of Canada made it direct, gave communities direction that they had to do Housing First for Youth and invest in it, they didn't explain exactly what it means. And so what happened in practice is that people established Housing First programs that had housing, but maybe no other component of Housing First. Many of them no supports at all. And if you have a brand that is weakened because of that lack of clarity, what you get are examples that people point to say Housing First doesn't work. Right? You have to follow the recipe. It's essential. Right? You know, in Toronto, it's been tough because people have for years said that Housing First doesn't work. You know, they'll say, well, you can't take somebody and put them in a high-rise building in Scarborough and then leave them alone. And the answer to that is, well, you could do that, but that's not Housing First, right? So we need that kind of clarity. And that's what we'd look at as we expand Housing First for Youth in Canada. You have to follow the program model. Okay, here are some great quotes. These will be made available. This comes from a great article by Sylvester and Kerman, who looked at Housing First and its evolution in Canada. So, those questions of fidelity to the brand and to the model are really key if you want to take something to scale, because otherwise you're going to scale something that isn't exactly what you want and people won't believe in. Here's some more quotes about this, and let's see what time we've got now.
You're good. You have 7 minutes.
7 minutes, okay. So you can address those things by also, not just making it a directive that you have to do Housing First, but you could also put in place measures to ensure fidelity to the intervention and accountability. So there are tools for doing that kind of work, for working with communities to review what they're doing in their Housing First program, and with the aim of not judging people, like you got a 47%, you're out. It's not that. It's to work with communities then on continuous quality improvement. So fidelity standards are really key, and the tools are there. We have developed a Housing First for Youth fidelity review kit. And availability of quality training and technical assistance is important, because you can develop a really good intervention and you can have like a great document and really helpful, but at some point the person is going to want to talk to somebody who's done the program and will need advice and input from somebody who's actually done it. So that's really important. We, as I mentioned, we've developed fidelity tools for Housing First for Youth, but we also have like operations manual, which needs to be updated, brought up to date, this kind of thing. So without quality training and technical assistance to support implementation, it can be very difficult for communities to really develop something and move with it. So considerations for taking Housing First for Youth to scale. So this is what we call a commitment curve, and it's for measuring where organizations or communities are at in terms of their understanding of a preventive intervention and or their desire to go down that road and invest in it. And so the goal is to move people up the commitment curve from contact, first learning about something, having some level of awareness, believing that this intervention would align with your organization's goals, this kind of thing. You'd like to plan it, you'd want to implement, but you need the help. So our community's ready. We did this report where we consulted with 150 people from youth homelessness organizations across Canada. And it was quite interesting. So it was a needs assessment where we used that commitment curve, but also asked a bunch of other questions to gauge their interest and knowledge. And so in the terms of interest in the prevention of youth homelessness, we asked them a series of questions. Can you indicate how much you agree with the following statements? So the first one here is, prevention is necessary to solve youth homelessness. And I was just floored when I realized that, basically 90% of the respondents said yes to that. Can you imagine any other issue in Canada where 90% of people agree? Maybe even in this room, right? And so that's important. But we also learned the things that are getting in the way. So a lot of the service providers felt their local community organizations and governance wasn't supportive enough of youth homelessness or interested in prioritizing it. People also strongly suggested that they needed help. They want to move in that direction, but they need help and assistance. They also remarked that they needed dedicated funds. So again, to go back to what we said earlier, there's an opportunity cost if you have to use your existing funds to do something innovative. We need to invest in innovation, and they need training and technical assistance. So this survey also showed, that in terms of Housing First for Youth, over 50% of people were in that zone of interest where they want to move in that direction. So we know that there's a demand and interest in this, so that's good for taking it to scale, but we need to do it right. And we also now know how to do it wrong. So there's interest across a number of the preventive interventions. So I've been telling people that for years I felt like one of my primary jobs was to get people to care about prevention and the prevention of youth homelessness in particular. But I don't feel like I need to work so hard on that anymore, because it seems like people are really ready. We're poised to take some things to scale, but we just have to finish the job. And I'm done with 2 minutes, which I'll sell to either of you for. Okay, so thank you very much, and we'll be open to questions after. There you go.
Nicely done.
Very good, Sue.
Do you need help getting over to yours?
I should be.
I feel robbed, though, that you took that opportunity from me.
Well, I feel robbed you haven't offered me a skill. That's how you work.
2 for each minute that you went under.
Thank you. Should have stuck with PowerPoint. Tried to get too
It looks
fancy.
so good.
Yeah.
Okay.
Thank you. Hello, everyone. My name is Jacqueline Sohn, and I'm a researcher at the Canadian Observatory on Homelessness, and I have the distinct pleasure of presenting in front of both of my bosses. Today, I'll be presenting a study funded by a SHIRC Insight Development Grant that essentially looks at how knowledge mobilization can effectively interact with broader socio-political conditions to advance social innovations. And we're learning from Kelowna, focusing on how they have taken up and sustained a social innovation called Upstream Canada. So we heard from Steve about why it's so difficult to not just beyond scaling, but take up social innovation in the first place, sustain it and scale it. And so when I first started at the COH several years ago, and I started out as a postdoc, and Steve and I were having discussions about what projects I could take on, and Upstream came up as one of the options. And I thought, great, this sounds like a fantastic project. And then I had colleagues ask me later, are you sure you want to take that? It's a really tough one. There's been communities who have had a lot of difficulty with it, despite a lot of hard work. And we know why, despite best intentions and hard work, why it's so difficult. Systems are not necessarily set up to take up social innovations, especially ones that require close cross-sectoral collaboration. But then I also knew that knowledge mobilization can really impact a different trajectory for policy as well as practice. And then Steve assured me that Kelowna is an innovative community and it's fertile ground for taking up something like this. And he was right. I really did see that there had been a community-wide shift towards a prevention approach. There was this huge widespread mind shift, which I found incredible. There's been great partnerships across organizations, including education, municipal government, decision makers, as well as receptivity to research. And so it really lends itself to be a foundation for further study on what it takes for a community to be ready to take on something like this. Well, what is Upstream Canada? And I apologize for those in the audience who were in my previous presentation, and I already covered this, but at just very high level, Upstream is a prevention-focused initiative. It requires close collaboration between the education sector and community-based organizations. It's an early intervention model focusing on students aged 12 to 14. The way it works essentially is that students complete a universal assessment And then based on results, there's a multi-tiered risk framework, and we at the COH, we analyze for risk based on indicators, and then students are offered opportunities to connect to coordinated supports. It seems quite simple, but it's actually very challenging, and that's because education and social services, as well as community-based organizations, are not conventional partners. They don't conventionally partner in the way that Upstream really entails. And I should say that this model originated in Australia, and this is the way they've been doing it. They've demonstrated great success, so 40% reduction in youth homelessness prevention. So we know it works in another context, but it's very difficult here because youth homelessness is not considered in the scope of responsibility for educators. Understandably, too, there's a lot of ethical concerns. There's potential risks, risk factors. School districts tend to be risk averse. And then there's, resources and capacity concerns when it comes to prevention, especially early intervention. And so this makes for an even more fascinating study on how did Kelowna take up such a difficult social innovation. And there were 4 key objectives here, essentially sought out to explore the sociopolitical climate, what conditions made Kelowna amenable to something like this, what were knowledge mobilizers doing to navigate these conditions, and then ultimately to be able to apply it to other communities so that they could prepare and get ready to apply a social innovation like this one. And our approach was exploratory. So we mapped out what were the seminal documents around the time leading up to Upstream's implementation. And you see some of them here from the COH and A Way Home, as well as Journey Home. We identified through snowballing who the key informants were. There were a spectrum of research producers, decision makers, and sector leaders. We were able to get 14 key informants to provide in-depth interviews. And then we also did some documentary analysis as well. And we landed on these 5 core themes for scaling social innovation. So innovation readiness really depended on this momentum that had been going on over many years. And it was really in large part due to local champions and networks that have been mobilizing over a long period of time in conjunction with the research and partnerships across the board. Strategic alignment, so there was this really intentional alignment with policy priorities, so shifting the language. For example, it wasn't just about youth homelessness, it was also about well-being. And so really shifting the language so that municipal decision makers would get on board. And knowledge mobilization, so it was so key, the role of research, that was really interesting to me. But it's because the research producers who were impactful with their work were turning research into actionable insights. And there was this great narrative going on that was really impacting the hearts and minds of decision makers. And then resource flexibility. I think something that we underestimate is the role of funders and the fact that we really need to get funders to understand when it comes to prevention, what that means, what that entails, what impact looks like, and how to measure differently, because it's so difficult to measure prevention in a way that most funders require. It's really important to have them alongside to understand and support different ways of looking at impact when it comes to prevention. And then the cross-sector collaboration piece was huge. So not just imposing and transferring this approach, but having the education partners truly on board and supportive, because the priorities align so closely with their own priorities. And this is just a representative sample of some of the participant perspectives. You can see here that people were talking about research and how it really guided them. Somebody said, I pounded down the doors until they let me in. And so it was a long game. It took a lot of patience, persistence. You see some participants talked about evidence, the stories, the narratives that they took from the research to align with decision makers. And the relationships that Steve was speaking to is so important, and networking energy, the commitment. So somebody said, I called Upstream the baby I dragged uphill for 3 years. And it felt very long to her. I think in the grand scheme of things, it sounds short, considering it apparently takes 17 years to get something like this off the ground. But it did take a lot of patience and persistence and pivoting. So taking the same evidence and research and pivoting it for different audiences. And then one of the research producers talked about the constant bidirectional flow of information. So this constant engagement with partners, which was interesting, because I think sometimes as researchers, we tend to think we have the research, we have the evidence, use it, but we actually need to be open to learning as well from the expertise on the ground. And so it's been just this great journey of learning collaboratively, which was very important. I really enjoyed this anecdote from one of our participants. She was a sector leader, and she was talking about how she encountered Steve's research and how using this one infographic or visual had been so impactful in just bringing the research to help decision makers conceptualize, okay, this is what we can do. We can reallocate resources in a way that makes a lot of sense. And she was talking about how she just kept taking this one visual, and it meant so much to her because it was a tangible thing that had so much credibility that people could just see very simply. Busy decision makers who don't want to read an 80-page report. And, I like that she said, I don't think that well-meaning people without research can often come to that conclusion alone. So she was able to use this to convert people's minds and opinions. So this is basically the summary of what we've learned about scaling for social innovation. These 6 lessons, really focusing on local champions, not necessarily, our usual mandating approach, but building up champions on the ground, aligning priorities, translating the evidence into actionable stories, adaptive funding, so having funders on board, open to different ways of funding and requiring evaluation, and then also aligning with other sectors, their priorities, changing the language without compromising the objectives. And then again, the consistency and patience required. I wanted to bring up this Upstream Canada model because I feel like it's such a great outcome of all this momentum that was happening in Kelowna. So we worked together with the community to develop this model that is still very relevant now. You see that equity is foregrounded there. It was a priority that was identified across sectors and really resonates with educators. So they're really excited to come on board when they were thinking about this as an equity initiative rather than youth homelessness specifically. And then you see the importance of the continuous research practice cycle, which I'm happy to say our relationships with our community partners is wonderful. We're continuing to learn from each other and build this model. And so, we're continuing to try to scale, and hopefully it's been 4 years. Hopefully it doesn't take 12 more years to reach the 17-year mark. And I think we're well on our way. So thank you very much.
Okay, perfect. Hello, everyone. Thanks for coming out and participating in this session. I'm Ahmad Bonakdar. I'm Director of Research at the Canadian Observatory on Homelessness. The stakes are really high, so colleagues and I just wanted to actually approach things a little bit differently, not just focusing on scaling, but also what we really need in order to be able to scale things, evidence-based, right? So I think across policy, especially in particular, sometimes policymakers need numbers, need data analysis to back up their decisions, right? So we want to kind of focus on that on this presentation, and I'm going to draw on the Family and Natural Supports Program. Many of you might be familiar with the program, but just in case, I'll give like a brief intro of what this whole program is all about. Just for the sake of clarity, and also for those of you who might not be familiar with the body of work, well, making the shift Youth Homelessness Social Innovation Lab, which concluded earlier actually this year, but its brand and legacy has remained, was a collaborative project launched in 2017 and co-led by the Canadian Observatory on Homelessness and Away Home Canada. So at the COH, which is a research-based institution, we try to bridge the gap between research and policy in collaboration with Away Home Canada and national coalition working to imagine solutions towards youth homelessness. So the whole body of work has culminated in more than 40 funded projects across the country with more than $10 million investment. I hope the numbers are updated, but it's a little bit more, more than maybe $17 million. That's right, okay. And a lot of these projects have been implemented and piloted, and the results are coming out. So stay tuned for our special issue on youth homelessness prevention, which is going to be out hopefully next year. I just wanted to spend just a little bit around the role of family in addressing youth homelessness. Of course, we all know that family is considered a critical foundation for shaping and facilitating adolescent development, but also there's a large body of research on that, right? And a lot of these resources are really saying like one core thing, that family matters a lot, and not just biological or immediate family members, but also the broader network. Like if we want to expand the concept of family in the broadest sense of the term, natural supports as well, and I'll define natural supports in a second, but I just wanted to make the case for how family as a structure is really important in terms of like shaping a young person's life over time. So family conflicts are often cited as number one reason why young people leave home. And with that in mind, we get to realize that's why so many young people who experience homelessness really trace it back to family breakdowns. So family could be an anchor, could be a breaking point at the same time. And when youth don't have family and natural supports behind them, the risks go up. More chance of ending up on the streets, struggling with addiction and mental health challenges, dropping out of school, or getting caught up in the justice system. So when we talk about family and natural support demonstration project, I just want to make sure that also natural supports are brought into the picture. So oftentimes we sit down with youth and ask them, okay, who do you define as family? So this is an important consideration because for many youth, because of their cultural, ideological, and intersectional backgrounds, family has many different meanings for them, right? And sometimes they actually refer to their, coaches, their teachers at school, their mentors, their elders, as important and significant people in their life who, play a significant role in their development over time. So the FNS program model aims to help youth enhance their relationship with their family and natural supports. And of course, build new lasting relationships because, caseworkers are not going to be there forever. So they could actually learn life skills to lead an independent life on their own. But of course, the ultimate aim is to prevent them from experiencing housing precarity, instability, and homelessness, right? By connecting them to family and natural supports, helping them return home, if safe, to get back to their home so they could actually stay in school. And the FNS program involves trained caseworkers who will help them achieve their goals. In terms of the spectrum of prevention, and Stephen Gaetz actually earlier this morning provided like a recap in our panel on the Housing First for Youth, if you happen to have been there. So Family and Natural Supports program initially emerged as a program, right? But it has evolved over time into a practice as well as a philosophy. And when I'm saying like a philosophy, because it embodies a philosophy that informs like every interaction, like centering youth voice, choice, honoring family and natural supports, as well as resisting colonial frameworks, and making equity foundational to how we work with youth. So scaling is not just about expanding a program. It's about like shifting how services, policies, and communities operate toward that kind of equity, youth agency, and relational supports. So going back to the demonstration project, so this project was funded by the Public Health Agency of Canada back in 2023, and then it concluded in 2024 across 10 sites in Canada. So we did like pre-test, post-test, like when young people entered into the program, we sat down with them and asked like, okay, how things stand in your life, okay? What are you experiencing? What led you, being referred to the program? How's your mental health? Stuff like that. And then a couple months later, when they have had a chance to check in with a caseworker, we asked the same questions to measure like where things again stand after a couple months, once they received support, when they were able to actually see measurable, improvement, or something else. Also, we engage with interviews, semi-structured interviews, and as well as focus groups with them. So today I'm going to focus on outcomes evaluation, meaning that some of the evidence base focused on, living arrangements, employment, and education in particular. So starting with living arrangement outcomes. So, of course, I just wanted to focus a little bit more on some of the questions that we asked them. So for instance, youth were asked like whether they live in a shelter or emergency housing, right? At the time of the entry into the program, like 12% said, okay, I'll live in a shelter. And then a couple months later, when we actually followed up with them and asked the same question, only 4% of the participants said, okay, I'll live in a shelter. And that's a huge, remarkable, measurable success of the program, and this is evidence-based. As another example, so for instance, we asked youth, like over the past 30 days, at any time, did you ever sleep away from your regular home because you were kicked out, ran away, or were abandoned, right? And then at baseline, so around 24% said, okay, yes, I had to. And then at follow-up, we have like a significant reduction in terms of the participant responding yes to that question. So in terms of employment and educational outcomes, so one of the things that actually stood out, and by the way, I'm just going to say that I'm getting really excited when our analysis comes out, and we get to present those. And I was presenting this very same bar to my wife, asking, okay, you see the blue bar and the green bar, and you see at baseline and then follow up, and she was like, okay, I see that, but what green bar? And I realized that my partial color blindness has gone worse because there is no green bar. And I say, the blue bar and the green bar. And she was like, there is no green bar. This is orange, okay? So I get to practice ahead of time because whenever I see that, I see green anyway. So the blue bar is the baseline, like when you entered into the program. And as you can see, for instance, in terms of enrollment in school, even though at first glance, it seems like, there is a little bit of reduction. Okay, 10 minutes, thank you. In terms of reduction, you see that percentage has gone down just a little bit. However, if you look at the middle bar, a lot of those young people actually completed their education and they graduated, right, from high school. And not only that, if you look at the right-hand side of the page, like over the very last bar, currently have a job, and the answer is yes, you see the follow-up bar has gone up just a little bit more, right? So a lot of those young people were connected to jobs, right? So again, this is what is working. So, and maybe this is a little bit hard to read because there's a lot of analysis around like how we want to present these bars. So I just highlighted some of the questions that we actually asked youth. So for instance, in terms of perception of support received from teachers, for instance, as you can see at baseline, 18% said they strongly agreed with the statement that, okay, the teachers did help me. And then by the follow-up, you see that percentage has gone up to 27%. And don't please ask me like what colors these are because I can't do that. But in any case, or for instance, I feel confident that I can learn at school, right? So you see that the positively stated, the scale, as you can see, if you compare like the colors, you get to realize, there has been some improvement over time. And a lot of these numbers are statistically significant. So even though it sounds like a small margin, but actually when it comes down to it, it's not happening due to chance. It has been improvement because of the intervention, like pre-test, post-test. So current living arrangements. So for instance, sorry, this is a little bit too, okay, this is better. So for instance, I might be asked to leave my home. And so if you look at the range of responses, look, 53% said, okay, I strongly disagree with this statement. And then at the follow-up, 70% said, I disagree with this statement. So again, it seems to be working. I feel safe living with the people I live with, You see that the percentage of, strongly agree actually increase over time, like after a couple months. So, and this is like evidence-based. This is what is working. And then a couple of other, actually, I think my colleague earlier this morning distributed some of the findings like a handout, FNS snapshot, that's what we like to call it. Some of those results have also been printed out. So in terms of mental health, so for instance, the percentage of participants who said like their mental health, they're satisfied with their mental health, increased like double, 2 times. I discussed shelter use. Quality of life, as you can see, has increased over time. And in terms of conflict resolution skills or communication skills, as you can see, there is a measurable improvement. And even though it sounds like a 2 score point, this is a statistically significant improvement. Am I doing in terms of time? All right, okay, I'm gonna
We have lots of time.
close up.
I can let you go.
All right, so yeah, and there were some interviews. I'm not going to focus a lot on interviews because there is another session, that my colleague would go over that. I think it's scheduled for tomorrow. But also the narratives highlight how emotional support, mentorship, as well as coaching, from caseworkers fostered really stability and self-confidence among youth, which enhanced their engagement with the, school, preparing them to pursue their educational employment goals and towards their future career development goals. So in conclusion, I just wanted to focus on how FNS demonstrated that prevention is possible, is transformative, and how building trust, equity, and emotional support actually can lead to enhanced outcomes, which positions FNS not just as a program model, but also as a practice and core philosophy, the way we approach things, the way we work with young people. So as an example, it centers youth choice. It honors, youth-defined family and natural supports. And it calls for scaling up this program across Canada, right, and internationally. I think listening and tuning into my colleague's presentation, it was like a 2-episode documentary, right? So I'm just trying to say that I guess we can make a case for scaling up, and that would be my message to end with. Yep. Thank you so much.
Great job, everyone. You guys made my job really easy. I didn't have to throw Skittles. So we have lots of time for questions. Is there a helper in the room to circulate the microphone, or are we going to have to ask people to stand up in line behind the mic? Is there a helper? Oh, okay, wonderful. So if you wouldn't mind circulating the mic, that'd be great. We have a question up here. Félix Antoine.
There'll be Skittles up here for you.
Not up close. My eyes suck up close, but I can see far. And if you guys want to stay seated, that's okay. Just make sure you speak into the mic when you respond.
Yes, so my name is Félix Antoine Véronneau. I'm working for Centraide United Way Greater Montreal. And thanks so much for your presentations. And I was thinking, as a potential funder who might want to scale these interventions for impact, we might not be able to fund everything. We might need to make hard choices. So how to discriminate between those 3 interventions and potentially others? Do you have indicators that would be relevant for potential choices? And then another question is, the exit strategy always governmental intervention in the end for scale up, or do you think about other exit strategies?
Those are good questions. I would argue that family natural supports is an engine that can drive your Housing First for Youth program. It can exist as its own program. It should be part of upstream case management. So these aren't all necessarily mutually exclusive. The Housing First for Youth program model, I think that our research on that's really demonstrated the efficacy of it. So it's more expensive than family and natural supports because it involves a housing component. But these are some of the decisions you'd have to make. FNS is less expensive, which means you can do more of it. But Housing First for Youth really clearly demonstrates that you can stabilize housing and focus on well-being. And Upstream is an example. They all have their role. The thing that Upstream does that I think is really important is based on some data that we have from the Canadian Observatory on Homelessness. So we did a survey several years ago with about 1,200 young people who were currently homeless. And the key piece of data that came out of that was that 40% of all currently homeless youth had their first experience before they were 16. And the characteristics of that group were very different than those who had their first experience at 16 or older. So more involvement with child protection, more adverse childhood experiences, more episodes of homelessness, more likely to have a learning disability, mental health challenges, attempted suicide. And so generally in Canada, we don't do anything for that group of young people. Like homelessness services start at the age of 16 or 18 or 21, depending on the community. And what Upstream allows us to do is get to young people and their families who are experiencing those difficulties that could be 12 years old, right? And so I think that it's a fantastic one, and it also points us in a direction where we need to go around preventing youth homelessness, which is to not make everything the responsibility of the youth homelessness sector. We need to take a cross-systems approach. You know, if you think of child protection, in Canada, about 0.3% of young people have had some kind of engagement with child protection, not necessarily being apprehended. For young people experiencing homelessness, it's like 58%. So public health, healthcare, the criminal justice system are implicated in producing a lot of homelessness. They should be part of the solution as well. And so Upstream's, so I didn't land on a single thing because they're all, but I've managed to talk about all three of them in very positive ways. They achieve different things. And so, but the common thing they achieve is a reduction in risk of homelessness, you know, and better outcomes, right? Because we think that in thinking about youth homelessness prevention, we can't just think about housing stability, right? If we focus on well-being and a basket of things, you know, that young people feel safe, that they have connection to meaningful adults in their lives, that they're engaged in school, if they have lots of assets, the housing part may take care of itself. So. The exit strategy? You mean to fund things? Oh, yeah, it could be that. It could be, and there's different orders of government that are there in Canada, right, according to our Constitution. But the philanthropic sector could, and, you know, a lot of people do get money for services from the philanthropic sector. There's no reason why an investment, a large investment in this couldn't happen. And move things along, you know, because in some ways, philanthropic sector can be more nimble than government can, right? And it can also, like, you know, the more we have funding to support taking up these innovations, it's a scaling question, then it's more, you have your proof of concept, the opportunity to really demonstrate that something works. And so, yeah, there's definitely different ways it can be funded. Yeah, and in terms of government, it can be funded by different parts of government, so that's important.
Thank you.
Thank you for the interesting presentation. I'll come over here and look at my victims.
Well, there we go. I was wondering where the voice was coming from. So.
I've listened to one presentation on Upstream. And when you're a foster child, you think of two things in your life. Mm-hmm. When you're a kid, you think about, are they coming to get me today?
Yep.
And when you're 18 and you don't have a foster home that is your foster home, you think about, where the hell am I going now? And the third thing that happens with Indigenous kids, and it's because I've experienced it, is when you go back to your home community, you're not accepted there. So when I listen to all of your presentations, I find it very compelling and very interesting. But it sounds like, to me, I'm sorry, it sounds colonial. It sounds like, again, we know what's good for you. I don't hear anything about interactions with First Nations or Métis groups or Inuit groups. I don't hear anybody saying, this is really compelling, so we're going to empower Indigenous groups by working with them and giving them the power to make those decisions for their kids. Yeah. I don't hear that. Yeah. For me, that's a problem.
Right.
And I did say that to my good friend here at the last thing, because in Saskatchewan, where I come from, there is no plan there. You are 20, you're 18 or 21, and you're out the door. So, you know, I see all of this, and I listen to it, and I'm 63, and I want to believe right, but I'm skeptical.
Right.
Because we're tired of people coming into our communities and telling us this is what's good for you, and that's what I'm hearing today. And I'm sorry if I'm hurting your feelings, but that's how I feel. So I wanted to know why it hasn't all of these sectors, the housing sectors, the homelessness sectors, sat down and said, look, this is how we want to help you in your communities, empower you, give you the resources, like show you how to get there. I haven't heard that. And so, you know, I wanted to know, why hasn't that happened? And why are we still approaching things in a colonial manner? You said it took 17 years to change things. Well, brother, we've had residential schools. We've had day schools. We now had the 60 scoop, which I'm a survivor. And now we've got the Millennium Scoop. There are more kids in care than even during the 60 scoop. So something ain't working. And so, you know, all the research that you do and all the kindness you show, thank you. But where is the empowerment?
Yeah.
That's my question.
Yeah, thank you, and I think I want to say you're right to be skeptical.
Sir.
You're right to be skeptical, because the history, our history of colonization, which continues, is littered with examples of well-intentioned but harmful things. So I think that we always have to remember that. In doing some of the work around these program models, we didn't discuss it here, but with Housing First for Youth, for instance, we have supported our Indigenous partners to develop to develop an Indigenous-led approach to Housing First for Youth, right? So it was designed, and even the research was Indigenous-led. And so it's based on, you know, community and culture and, you know, engagement. Doing Housing First for Youth can mean, or not Housing First for Youth, yes, Housing First for Youth, but also family and natural supports means we have to be thinking about how these things can be applied that make sense in terms of what is a family if you're Indigenous. So the more that these things are offered up as things that can and should be Indigenous-led, the better it will be.
Yeah, because it just seems to me, though, that we still have non-Indigenous groups coming into our communities, even at this conference. This is the first one, but I still feel like I'm being led around by the nose, and my nose is pretty big, so it's not going to grab. You know, and it wrangles me. It bothers me, because I don't see how you might have talked to some people, but I still see non-Indigenous groups taking the lead, running with the money, telling us how things are good for us. That's a problem. That's a problem for me.
Right.
And as a mushroom, a grandfather, well, luckily my family is the first. No, my daughters and my son are the first generation that haven't been taken away.
Right.
And my granddaughter is the second generation now that also is not being taken away. So I'm very concerned about that, because I grew up as a foster kid, and as a 60 scoop survivor, seeing everything that I have and experienced, that I really have kind of a keen mind when I sit down and talk and listen to people about this stuff. So I hope I haven't, it's not my intention to come in and disparage the good things that you're trying to do, but I'm just telling you how I feel, because I live it.
Yeah. Well, thank you. And, you know, I totally respect what you're saying, and you're speaking, you know, the truth. One thing that I want to tell you is that in doing this work on prevention, there are emerging across Canada some Indigenous-led models of youth homelessness prevention that are like fantastic, that they need to be scaled, right? And so that's enlightening. Like there's, tomorrow is the Youth Homelessness Prevention Awards, and in the previous 2 years, the preventive interventions that were celebrated were Indigenous-led, and they're marvelous. And so we need to, so those are positive signs that some good work is being done. Thank you for taking my question. Yeah, thank you for your question. Wow, a lot of people.
Thank you very much. My name's David. I'm from Regina, Saskatchewan, and I just want to say thank you for your research, because as a coach and a mentor, I know what I'm doing is coming from the heart when I'm dealing with my youth and anybody that I help try to get on the right track. So the research sits well with me, because like I said, it makes me feel really good today knowing that what I'm doing is working. Because with my youth, anybody that I'm working with, it just takes time to gain their trust. And with their inner child has been hurt. So it takes a lot of work with them. And when you're talking from the heart, authentically with them, they open up. It just takes time. And it's like, collectively, we're not going to go anywhere. Individually, that's where you got to learn to forgive a lot of people that hurt us as children. Otherwise, without forgiveness, you ain't going anywhere. You're going to stay mad at the world and continue to blame whatever was going on in your life, I guess. But as for myself, 18 years in and out of prison, mad at the world. And at 45, I had to ask the Creator my why, and the Creator says, you have unforgiveness in your heart. So when dealing with that and getting on that road of the journey of forgiveness, man, many doors closed and many doors open up, and it's just like life is worth it. So I thank you for this research, because it puts me in my perspective and when I'm on that journey and how I'm helping my youth and anybody from getting out of prison, that I'm doing my purpose and my calling. Thank you.
I want to thank you for the work that you do, and talk for a second about things taking time.
Yeah.
I think that one of the things in thinking about youth homelessness is that we often I call it adolescence interrupted. We rush to give, raise expectations like, why aren't you saving up money for rent, and why aren't you doing this, and why aren't you doing that? And I think the best interventions for youth, whether it's from, families or programs, has to recognize that adolescent development, these things take time, and we have to be patient, and we have to be committed, and then we'll get better results. And because things take time, these kind of interventions, we have to be mindful not to load up the case managers with huge caseloads, because if you have a caseload of 20 or 25 for Housing First, all your work is putting out fires.
Yeah.
When all that important work about recovery and also happiness and finding what you like in life and all of that, that's such important work. And we need to make sure that it can be done in the way it's meant to be, which includes how you're approaching things with that focus on.
Because there's a Lakota proverb that says the longest journey we're ever going to take is 14 inches. 14 inches, the longest journey you're ever going to take. Thanks.
Hi, my name is Caitlin Morin. I work in Saskatchewan at SIT, so Saskatchewan Indian Institute of Technologies, and I'm the project specialist for the Oyatake Partnership, which is a partnership between the three institutions, which is SIT, Gabriel Dumont Institute, and the University of Saskatchewan. And so the Oyatake Partnership is a partnership that helps support Indigenous youth ages 15 to 35 before, during, and after post-secondary. And one of our pilot initiatives this year was to support Indigenous youth who are experiencing homeless or transiency. And pilot initiative. We have a coordinator who is supporting Indigenous students at SIT and GDI and doing emergent housing support right now, whether that's emergency food kits or bags and different things like that. And I really appreciate the family and natural supports intervention as well as the housing first for youth. And I was just wondering, do you feel like those two models have any place in a post-secondary context and in that wraparound kind of support model? And if so, could it be modified to almost be a part of it, or could it be shifted? I don't know if that makes sense, but yeah.
I think you absolutely can modify these things and to make them developmentally appropriate. The things that you would be doing with young people with Housing First for Youth are family and natural supports, to build their connections with meaningful adults in their lives. Everybody needs that, right? Like, we all need that. And so there's no reason why you couldn't do these kinds of things. In post-secondary situations, I teach at a university. There's homelessness at universities, and a lot of that homelessness is students, right, who still manage to go to class, but they're sleeping, they'll find the parts of the university that are kind of active all night, like and so Eric Weissman is a researcher. I haven't seen him at the conference. Have you seen him? But anyway, he does research on this, the homelessness amongst university students, and there's some interesting work being done. But it's, until he started like really pushing that, like no one was really talking about that, right? And so, he might be somebody worth talking to, because, and I would ask him, like, what are the things that you think are really working, right?
Thank you so much. And I was at the presentation this morning with Housing First for Youth, and I was just going to ask, there is a training or something that can be applied to adults, right, for Housing First as well?
Oh yeah, there is. Yeah,
okay.
Absolutely. Okay. And you need training with those things if you want to make sure that they show fidelity to what you're trying to do.
For sure. Thank you so much.
We have a question in the back. Caleb, is it Caleb? No. I tried to read your name tag and I failed. What? Can I get your name though? How bad did I do?
My name's Gavin.
Gavin.
I'm from One Roof Youth Services in Kitchener. I just have one question. You mentioned Housing First for Youth Fidelity Review Kit, Fidelity Tools, and an operations manual. Where could I find those?
The operations manual, you can find them at Homeless Hub. If you were to put Housing First for Youth and just Google that, it'll take you to where a lot of the resources live.
Okay, thank you.
We have time for more questions.
The other thing you can do is you can contact us if you wanted to learn more. That's it.
Yeah.
Hi, my name is Tammy from Yellowknife, Northwest Territories. Just wanted to mention, we talked about no services beyond under 16. Our shelter is open to 12-year-olds. Okay. The only reason is because there are 12-year-olds that are homeless and that are waiting to get in the door, waiting for their 12th birthday. So many different reasons why, and system failures there. Also, I have to confess, I watched the Jays game last night, so I might have been napping and missed this. But I see all of youth homelessness work as prevention, all of it, because we're preventing adult homelessness. So I'm wondering if there's any research considered there as to doing family and natural supports and Housing First for Youth, and how that's preventing youth from becoming homeless adults.
To do that, we need longitudinal research, which is, I won't go into the technical parts of it, but our ability to do that is improving. And so that will come in time.
I wasn't sleeping.
Well, you should talk to Robert sitting across the aisle there. I think Robert might have been up late last night too.
Two baseball games for the price of one.
That's right.
Any other questions? Okay, well, I'd like to thank all of you for joining us today. There's a lot of content out there, and you chose to spend your time with us. Thank you. One
right.
final housekeeping item. The reception starts in 15 minutes on the 7th floor. If you cannot make it, please come and see me immediately. It's very important that you give me your drink ticket. Thank you, everyone.